So how does it work? This actually is not a super new therapy. It's been FDA approved since '08, so 16 years. If the TMS, if that was when it was born, it could drive now. That's how long TMS has been around. So it's been around for 16 years. It utilizes a magnet similar to an MRI. So the people that can't do it are the same people that can't do MRIs. They have a pacemaker, they have an implanted vagal nerve stimulator, implanted spinal stimulator, baclofen pump. You just have to be careful. Similarly, you would on an MRI. It doesn't have the same effects as an MRI where it like pulls it out of your body or anything like that, but it can cause it to malfunction. So as long as they don't have any metal in their head, face, implanted devices, but it uses a coil, two magnetic coils, and the overlapping electromagnetic waves can either activate or inhibit a region of the brain based on the protocol you're using. So it's usually small, like a quarter-sized area over the left prefrontal cortex. We just have to get the electromagnetic pulses to travel 2 centimeters to the brain, because it's on the very outer part of the brain called the cerebral cortex. And then from there, you need the repetition to create neuroplasticity. Neuroplasticity always will need either intensity or repetition. You can either have one very traumatic event or a lot of microtraumas, right, to cause change in the brain. Well, on the flip side, you can have one large event or a lot of smaller events to create changes in the brain in a good way too. So this is what it looks like. I know I showed you a picture of myself doing it. I have a Meg venture. I know we'll talk about NeuroStar in a bit. I have no sweet spot in my heart for any specific TMS manufacturer. A lot of the research that I've read that came out of Stanford used Meg venture, which is why that's what I was partial to. But a lot of them look the same. It's just a coil on an arm. You line it up. Before you line it up, you're doing a lot of measurements. You're measuring, the circumference. You're measuring like inion to bastion. You're measuring, tragus to tragus, getting that 10-20 system down that you do with neurofeedback and QEEGs. But then once you find the patient's location, you just put the magnet over it, and they hang out there. Some of the faster protocols just take 6 minutes these days. Some of the longer protocols take 20 to 40. It just depends on what you need. So there are accelerated programs now. Has anyone heard of the Saints TMS program out of Stanford? Nice, a few. Nice, okay. So for a long time, they thought that we just needed to do it like once a day, every day, and then slowly titrate off. And then someone said, why? Why are we doing it that way? And the answer was, because that's all they'd ever done. So then some crazy neuroscientists at Stanford, and psychiatrists and psychologists as well, and some of their graduate students, decided, what if we just do all those treatments but in 1 week instead of doing 40 treatments over 2-3 months? And they did it. And what they saw is that there really wasn't a worse effect. Like, people didn't get less better. It was really comparable to the treatments that took longer. So that's why the Saints, it stands for, Stanford is what the F stands for, Accelerated Intelligent Neuromodulation Treatment, I believe. They've changed it now. Now it's just SANS, just a little less catchy, but SANS. But the thought is that instead of doing your 40 treatments once a day for 40 days, not including weekends, so it ends up being about 8 weeks, you just do 8 treatments a day for 5 days, or for 4 days, right? Get all 40 treatments out of the way quickly. And I've found in my practice a lot of good success for patients that are actively having suicidal ideation or had just come off of an attempt. They showed no difference in age. Like, age had no difference on who was benefiting. Sex had no difference on who was benefiting. And then, similar to most research, the worse they were, the bigger the change. Like, that's how it is for everything, right? Like, if you have this far to go, there's more room for you to get better. Where if you start only having this far to go, you don't get better as well, right? It doesn't mean it wasn't helpful. It just you didn't have as far to come. So there were several different options for TMS. There's a high frequency, utilizing usually over 10 hertz. They say anything over 1, but it's usually over 10 hertz. A hertz is an impulse per second. So 10 hertz is 10 impulses per second. They do this over the left dorsolateral prefrontal cortex, and because it's high frequency, it's excitatory. They notice there's a downside of this, is anytime you're stimulating the brain, there's a chance that giving extra fuel to a brain that's prone to seizures could cause more seizure activity, right? So it doesn't induce seizures in people that have never had seizures, but if you have a history of seizures, it could be a little risky. So we have the low frequency method. Instead of doing it over the left dorsolateral prefrontal cortex, we do it over the right side. And instead of it being activating, it's inhibitory. So it ends up being a 1 or less hertz over the right dorsolateral prefrontal cortex, and it decreases the right side. And the thought with that is that there'll be a rebound effect, where if you can't increase the low, what if we drop the high, and then hope that the rebound is that they both become healthier and more symmetrical together. And then more recently, they had the intermittent theta burst. So intermittent theta burst is a way to stimulate over that same dorsolateral prefrontal cortex, but it takes a 20 to 40 minute protocol and shoves it down into a 6 or 7 minute protocol. And the research shows that it's just as good. There's not a worsening effect. Sometimes the effects wear off a little faster, but I'll have Martha talk a little bit more about her experience utilizing TMS. A big thought though with this is that it's not a cure. It's not like you get your dosage of TMS and you never have depression. Some people do never have depression again, but it's not the majority. Similar to counseling, it's not like once you finish your sessions, you're never going to need counseling again. Life's rough. Life's tough. But the thought with that is that you could just do it again. And usually when you need a repeat round of TMS, you don't need as many dosages. You don't need as intensive therapy because you've already laid down the groundwork. So even for those 60% of people did sustain in 1 year, and the ones that didn't sustain usually do respond to just another round of TMS. So when we're talking about TMS, I'm going to let our patient and patient advocate, Ms. Martha Rhodes, talk more. Feel free to scan the QR code. It goes to the website, and then my cards are in the back. But I'm very excited to have Ms. Martha talk about surviving and managing depression